picture. Yes, there is a golden age of medicine coming for specialists, for generalists. But yes, increasingly we will start moving towards self-care over time. Whether it is 3 years or 5 years, which time will tell. But AI will give more power to patients. Though there is always a doubt in terms of what level of accuracy it will have. But I think what we are seeing in our work is that it will be fairly accurate. So the future of medical specialties, some will cede their power to the technology fully, which is mostly driven by the general ailments. Some will become shared decision making with AI, with patients and the specialist, and some will kind of move towards a multi-speciality ecosystem. And I think 3 specialties clearly for me stand out: dermatology, radiology, general physicians. But more specialties like surgery is moving with robotics. We could have Shafi, he could get visa, but I can think that more specialties will start using AR, VR, gaming. I see Oli is here. So it's an interesting time. I don't think that we have an accurate prediction, but we're going to change the way we look at medical specialties, and more power will move towards self-care over time. Thank you.
Charles Dickens said we are in best of times but worst of times. We are in best of times, particularly post-COVID, because I think COVID was a huge leap in telemedicine and digital health. I think that truly allowed us to use digital health to the next level. In endocrinology or diabetes, information, radiology, pathology, I think AI is right up there. But when it comes to complex decision making, we are in worst of times because we have too much of data and clutter. And sieving that data still needs a human mind and still needs a clinician behind the scenes. We have some excellent experiences in lifestyle medicine. You can't make generic advices like eat more, sleep less, sleep more, walk more. You can actually personalize care. So when you're personalizing care for that individual, because of heterogeneity, because variability is an inherent characteristic of the biological world, and we are all operating on a normal or a Gaussian curve. So we are a probabilistic science, decision-making support or shared decision-making. It gives us the cues as a doctor to help people living with diseases like say diabetes or obesity better. We can definitely look at preventive strategies, remission strategies, therapy strategies, and also ensure that who will be a responder, who will not be a responder. So putting them through risk scores. We have done the biggest challenge which I see in AI is generation of high quality evidence. I think that is the biggest gap which I see. We have done some randomized control trials, for example, with a diabetes remission program in Bangalore. We replicated that now and published in AGM Catalyst with the Cleveland Clinic. But it's a long way to go. So I think there is a data clutter. In the medical specialties like diabetes where numbers are involved and big data is required, or endocrinology, maybe, or radiology or pathology, they have evolved quicker. But my colleague Dr. Anil Nayak is here, and I'm sure he's an orthopedic surgeon. Over there, it's a long way to go. I mean, to fix your fracture, you still need your instinct, you still need you might get some direction from AI. So I think it's an evolving science, but all of us have to adapt it. And the second biggest game changer beyond COVID has been the smartphone. Wearables are changing the way we look at overall preventive health, future health, and living longer. So I think we are here to stay, and I personally feel very passionate about the entire science of digitalizing healthcare with a human touch. Thank you.
Law. So when I started doing or studying radiology, it was an analog era. I have seen every film as an analog film, the dark room techniques. Radiologists were never in the front line. But once the digitalization happened to radiology, that was way back in 1990 and beyond, the entire process of patient diagnosis, patient treatment, looking at the entire clinical history and correlating with radiology findings entirely became so natural that patients were given a treatment, a precision medicine was given, so that the waiting period for diagnosis as well as the outcome of the disease was much slowed down. Then came obviously the era of CT and MRI. And as you know, CT and MRI are going to be the front runners of diagnosis of any disease in the body, both functional as well as anatomical. So radiologists are not there as image readers. They are basically now they will become integrators of all patient data, including the image, including the clinical history, incorporating the pathological findings, and trying to give a diagnosis which is much more smarter than what they did 25 years back. Now, when I say radiologists are integrators of patient data, AI is going to play a major role in all this. And when I say AI is going to change the way that a clinician is going to interpret a radiology image or a CT scan or MRI, I mean the interpretation of data is not going to be what anatomy that I am describing, but it's going to be actually the prediction of biology of the tumor from radiology or radiological images. So this is going to be the future of radiology. The baby right now is interventional radiology, as everybody knows. Try to do everything in a minimally invasive way. Try and guide with precision, with laser guided pinpoint, and maybe in future, all the angiographies, including the coronary as well as the neuro interventions or the peripheral interventions, will all be done by robots. And mind you, the robotic radiologist or the robotic cardiologist will in fact guide or do a procedure about 100 kilometers place of work or maybe 200 kilometers or across the globe. So what we are trying to do is democratization of radiology or democratization of clinical information that we see today. The entire data set of a patient is going to cross borders, and teleradiology is one of them. But to tell you frankly that teleradiology is not a standard way of reporting. In India, what we do is just an initial reading of images, either from US, Canada, Australia, other places. But what is going to happen is we are going to cross borders, packages will have preventive radiology. They will have each test as a separate one. But mind you, if you do carotid intima media thickness, if you do ankle brachial index, that is ankle versus the brachial ratio of blood pressures in the systolic manner, or if you do the widest diameter of the aorta in the abdominal aorta by ultrasound, this is going to change the way that clinicians are going to see the patients, and longevity is probably the ultimate goal of each and every clinician. So at the end of the day, radiology is about patients, people, passion, and definitely a predictive science where we are going to predict how the biology of the tumor, how the disease process is going to affect the patient. Thank you.